The morning of December 13th, 5:45 a.m., here we go. We're off to Caring Medical, Fort Myers, to see Dr. Hauser and for the evaluation, the testing. The first test was the DMX, Digital Motion X-ray. They put you through a motion X-ray. It creates a video of the X-ray. Unfortunately, I had to move my neck in all kinds of different directions: extension, flexion, left, right, twisting, turning, open mouth, ear to shoulder, and I've had to keep my neck in the neutral position to prevent things from getting worse. So I understand the test is required because they need to measure the extent of the instability, which it's very, very helpful with. Unfortunately, for people like me, you pay a really big price for doing this test. My symptoms were horrible, and you'll.
So all this fluid like there,
Mm-hmm.
and then here, so you have, these are just signs that you have a blockage somewhere here. So you have, what we term increased brain pressure, increased, and then all these things are flat here, so all the pressure here is screwing up your brain stem, basically.
How about on the top there?
Yeah, the same sort of things. You're getting brain atrophy.
Mm-hmm.
Yeah, you're getting brain. Some people would say, one of your aglars, they'd say the white there, maybe there's a sprain to your aglar.
Mm-hmm.
Like some of the purists would say, there's a sprain. And these I'm just eyeballing this, but it looks like your optic nerve sheaths are real high.
Mm-hmm.
Like so that's another sign of intracranial hypertension. Some of this is like MR angiogram.
Yeah.
Okay, so let's look. So your right, looks like your right jugular dominant. See the left, it's getting compressed.
Mm-hmm.
The left jugular is getting compressed. It's like what normally happens is that you get the pressure off, like cysts and things,
Mm-hmm.
they just go away. So it's really just about us getting rid of the pressure. Because you could look at this and there's lots of different things, but it's just like you just get rid of the pressure and then.
Let's see that.
The brain, as you know, has tremendous regenerative capabilities. You just got to get the pressure off. It's like the vagus nerve. To me, it just looks like it's high brain pressure, like real high. What was your thoughts on this, Brad?
He definitely has some instability. C3, C4, C1's real high.
Oh,
He has
okay, no.
severe instability at C1, C2, but mostly on the left, I believe. His right showed like a more mild instability, but it was much more severe on the right, or on the left.
And the neck vitals.
It was some of the biggest optic nerves.
Okay, yeah, that's what it looked like.
Yeah.
That's what it looked like.
His vagus nerves are like 0.7, I think, on one side.
So it looks like its C2's rotate a little bit to the right.
Mm-hmm.
There's rotation on this. That's on the left. Why don't we agree though, Ron? At some point we'll do a CT scan like in the office. Let's say the primary lesion is compression of the carotid sheath on the right. I think that's the primary lesion.
Thank you, Dr. Hauser.
Ron, let's just do that. We basically last week we got to install the CT scan, but the radiation exposure is almost zero, and it's going to give you and me a good 3D picture of what's going on. But it seems like you're going to be a really good candidate for what we do. I just want to see the anatomy a little bit more, because obviously the symptoms are devastating to you. And so obviously from this, you have the C3 vertebrae has to be moved forward, right? Because that'll open up some space for C2, I guess C4. Yeah, C4 has to be moved into. So I'd say in the ideal setting, I'd say you have to see him let's say a week or something, and I could start Prolo sometime next week. That's what I would do.
Okay.
Just let him get you started a little bit. You know, as far as like the anatomy, the adjustments, there's nothing high velocity, the weights, see how you feel, then I'll see you sometime next week. And we'll start Prolo.
Okay.
And I normally see about every 2 weeks
2 weeks.
for Prolo.
Okay.
And in between, you'll be seeing Dr. Hutchinson just for one of the goals is just to open up your jugular veins. So you drain your brain better when you're upright.
Okay.
But right now, once you're able to, you should lay down every hour for 5 minutes. Just to get your pressure down.
And so the treatments you're saying every 2 weeks apart, as opposed to the 4 to 6 weeks?
Yeah, if you're living here, that's how I would do it, because it's not practical to go from Maui to here. Initially, I see you a little bit more frequently just because I'm trying to, get you over the hump.
Yes.
So I'm going to say every 3 weeks. So I do 3 visits every 3 weeks, and we'll do the 4 to 6 weeks.
Okay, great.
That'd be the best. Okay, Fred. Okay, look forward to seeing you.
Hey, thank you for everything. God bless you. January 3rd, going to our chiropractic evaluation and adjustment with Dr. Hutchison.
Okay, so we're fitting Ronald for his first round of cervical curve correction, and he has a 5-pound reverse chest weight and a 1-pound halo weight on. So when you're wearing these weights, Ron, we want you to have your feet nice and wide, strong, abs engaged, glutes active, chest rested, and then you're envisioning, we just did this together, you're envisioning that this weight around your neck is kind of pulling your neck up this way, right? And then your chin is down a millimeter, right there, good. Can you turn your body to the right about 60 degrees with your feet as well? Turn your feet, good, right there, feet a little bit wider, good, abs engaged, glutes active, resting your chest, envisioning that this weight is pulling you back and up, and then the chin is down that millimeter. Beautiful. So this weight is on parallel to the ground. The nose is directly forward. This is pulling you back. You're resting your chest and arms. Exactly it. We're going to have you wear this. Do you feel okay? For 2 minutes, 5 times a day. Okay? And we'll show you what it does to the neck curve. Nikki, why don't you show them real quick? Because we got a good picture here. So basically, when Ron came in, let's see, where were we? So there's very small subtlety. So this is when Ron came in. And let's see where we got it to. And this is where we got it to. So now we have this like a little bit more of a curve here, and it's really tall on the top. And before,
Like the military neck before, right?
well, it's very small difference. So, but I think it's totally the right thing. So before we had this going on, and then down at the bottom, what you can't see is it, which I did this image for, is it was really going on a harder angle down at the bottom. So with the 5-pound reverse chest weight, if we were to zoom in on the lower angle, which we can actually look at, it wouldn't be quite as sharp as this one. So we've reduced that sharpness in the very lower neck, and we're starting to try to, by having him, if you watch me, by having him go like this, what that's going to do is it's actually going to barely separate some of the spinous processes that are compressed posteriorly. So we're working on a few things, but definitely I think this is better for him. He doesn't get any worse symptoms when wearing this. So let's have you do this at least 2 minutes, 5 times a day. Is Ron going to stand down? Yeah. Okay, and then we'll recheck it within about 10 to 12 days. Okay, perfect, thank you.
The digital motion X-ray results confirmed cervical instability from the posterior longitudinal ligament and posterior ligamentous complex is indicated by anteriolisthesis at C3 on C4. Cervical instability from the capsular ligament is indicated by intervertebral foraminal encroachment on the facet joint at C4, C5 bilaterally. Cervical instability from the atlas and atlanto-axial C1, C2 capsular ligaments is indicated by an overhang of the lateral mass of C1 to the left. And there's also straightening of the cervical lordosis with disc narrowing and osteophyte bone spurring at C4, C5 and C5, C6. The chiropractic with Dr. Hutchison went really well. He used very mild, subtle techniques to realign the spine and other parts of your body as well. Here's my results. February 4th, we arrived at Xray Medical for the Prolotherapy treatment. Dr. Hauser pulled Jennifer and I aside to review the CT scan we had done on December 13th. The CT revealed spinal canal narrowing all the way down to 5.9 millimeters at the C4-C5 junction. The osteophytes are pressing into the spinal canal. Dr. Hauser mentioned there wasn't anything he could do to help with that, and that by creating more space with the prolotherapy, that eventually the body would dissolve the osteophytes. After reviewing the CT scan, we agreed to move forward with the prolotherapy treatments. Here I am getting the 60 to 80 injections into my cervical spine. It was extremely painful, a little bit worrisome, but I had confidence that the doctor was very accurate and had done so many of these that I could be confident in his ability to do this correctly. The procedure went well, and so on February 13th, my second treatment. The treatment went well. Again, very painful, but this time I knew a little bit more what to expect. Unfortunately, the pressure from the flying was really bad again. The intracranial hypertension, the pressure went up, and yeah, it was pretty rough. So I was there for about 6 days, and then flew back to Maui. It's extremely important for me to continue these treatments. We face a few hurdles. One is the money, so we're continuing to try to raise the funds to go, and hopefully that will happen soon. It's important not to have more than 6 weeks in between treatment. So hopefully we can secure the financial resources. Flying is a hurdle. Hopefully that medication will be able to help. You can help in any way you can. Let me know. Please reach out. I never used to like to ask for help, but when your back's against the wall, sometimes you just got to reach out. When people work together, it's amazing what things can be accomplished. So I just have hope and faith and continue to try. Thank you very much, everybody. Love you guys. Hope this helps. Anybody interested in more information, please put your comments down below. Thankfully, was able to go and get the proper, thorough, accurate set of diagnoses from Dr. Hauser at the next center.